This is Antibiotic Awareness Week. In this week, as a physician, I want to give some message for the community, for the for my fellow colleague. One thing we have to keep in mind that before prescribing any antibiotic, we have to consider whether this antibiotic or at all any antibiotic is required or not. If it is required, then we have to choose a proper antibiotic with proper duration. In most of the cases where we prescribe antibiotic, sometimes we are seeing that in that cases antibiotics are not at all required. Like in common cold, cough and cold, diarrhea, we are using antibiotics. Sometimes people are using over-the-counter antibiotics. So first, over-the-counter antibiotic usage must be stopped. And the second thing is, as a clinician, as a doctor, we have to think that if it is viral one, if it is any drug-induced diarrhea, if it is one antibiotic-induced diarrhea, so further antibiotic may worsen the condition, may hamper the health of the patient. So please do not prescribe empirically antibiotic, and if it is indicated, then you only give antibiotic. Sometimes before giving antibiotic, culture, we should send the sample for culture sensitivity test. Sometimes people are suffering from urinary symptoms. In that cases, we are giving empirical antibiotic, and one after one we change antibiotic, but it doesn't work sometimes. So before giving any antibiotic, you first just send one urine sample for culture sensitivity or urine dipsticks test, whether it is infective or not. If the dipsticks test, it is bedside or clinic test, if it is negative, then you need not to give any antibiotic. Sometimes elderly patient, female patient, they suffer from vaginitis. It is not the infective one. They complain of some irritation during urination. So we need not to give any antibiotic in that case also. So please do not misuse antibiotic. We have to protect our universe. We have to protect our flora so that antibiotic resistance we can prevent. That's it. Myself, Dr. Biplab Chandra. I am an internist of Calcutta.